Multiple sclerosis is a disease of the central nervous system. Affecting over 2.3 million people worldwide, it is a leading cause of neurological disabilities in young adults. Multiple sclerosis is considered an immune-mediated disease, meaning a disease in which the body's immune system mistakenly attacks the central nervous system. The central nervous system is full of neurons, which are responsible for transmitting nerve impulses. The axon is insulated by a protective myelinated sheath. Myelin is produced and maintained by glial cells called oligodendrocytes. The central nervous system and all these neurons are protected by the blood-brain barrier, which is a selective membrane that prevents harmful solutes from the bloodstream from entering the brain, while also allowing nutrients to enter. In order to understand what goes wrong when a person suffers from an immune attack, we need to identify some of the component cells such as T cells and B cells. T cells, or T lymphocytes, function as part of the immune system. They have many subtypes which play an important role in the immune system, but one of their functions is cell-mediated death. B cells, or B lymphocytes, are another cell of the immune system and are responsible for making antibodies which fight off antigens. For unknown reasons, activated T cells enter the blood-brain barrier, and cytotoxic or killer T cells target oligodendrocyte cells. By releasing cytokines, T cells cause damage and activate the B cells. B cells produce antibodies which target the oligodendrocytes and cause macrophages to further destroy the oligodendrocytes. There are 4 different types of multiple sclerosis. The first is clinically isolated syndrome, or CIS. CIS is defined by the occurrence of a neurological episode in which there is inflammation or demyelination in the central nervous system. While CIS is characteristic of multiple sclerosis, it doesn't mean that the condition will progress to a diagnosis of MS. Relapsing remitting MS is the most common form of MS. It occurs after repeated attacks or relapses, resulting in damage to the central nervous system, followed by periods of recovery or remission. After a relapse, symptoms may become permanent or go away depending on whether or not remyelination can occur. During the remission period, the disease shows no signs of progression. Secondary progressive MS is often preceded by a relapsing remitting MS and occurs when there is an accumulation of disability over time. It also follows the relapse-remission cycle. Progressive primary MS is characterized by the accumulation of disability from the beginning and without early relapses or remissions. Primary symptoms, or symptoms that are a direct result of the destruction of myelin, include muscle fatigue, spasms, loss of sensation, speech problems, poor coordination, tremor, dizziness, bladder and bowel dysfunction, and hearing loss. Cognitive symptoms are apparent 50% of the time and mostly consist of difficulty focusing, memory loss, and poor judgment. Multiple sclerosis affects people of all ages, but most people are diagnosed between the ages of 20 and 50. The life expectancy of those diagnosed with MS is reduced by 7 to 14 years, but the long-term effects of multiple sclerosis are unpredictable and the severity varies from person to person. The causes of multiple sclerosis are unknown, but research indicates that there are both environmental and genetic factors. Sun exposure may explain the north-south distribution of MS, because those who live closer to the equator are exposed to greater amounts of sunlight and have naturally higher levels of vitamin D. And vitamin D is thought to support the immune system and may help protect against immune-mediated diseases. Other environmental factors such as smoking and obesity in early adulthood, childhood, and adolescence is shown to contribute to the inflammation and severity of the disease in those who have been diagnosed. MS is not an inherited disease, but there is a genetic risk that could be inherited. The risk of developing MS is increased if a first-degree relative has MS. There's still a lot that's unknown about the genetic factors of MS, but 200 genes have been identified that each contribute a small amount to the overall risk of having MS. And more specifically, alterations in the gene HLA-DRB1 have the strongest genetic risk factor for developing MS. For women, the likelihood of developing MS is 2 to 3 times higher. Those of Northern or European descent have the highest rate of developing MS, while those of Asian, African, or Native American descent have the lowest rate. This correlates with the evidence that areas farther from the equator have a higher risk factor due to the levels of sunlight and vitamin D. Certain infections such as Epstein-Barr, as well as autoimmune diseases, are correlated to a higher risk of developing MS. There's no cure for multiple sclerosis, but there are treatments which can help manage symptoms, improve function and mobility, and treat flare-ups. Treatments vary depending on factors such as age, overall health, past health, level of sickness, and personal preference. There's lots of different types of medications available to people who have multiple sclerosis, but many treatments involve rehabilitation activities such as physical therapy, occupational therapy, vocational therapy, speech and language therapy, and cognitive rehabilitation. For many, these practices help regain independence, motor skills, speech, and thinking skills. Multiple sclerosis was first identified in the 1800s by a neurologist who studied the brain of a patient who had died and discovered scars on the neurons in the brain. As technology has advanced, scientists have been better able to understand the disease, and more recently, modern imaging techniques and new technologies have allowed us to discover more information about multiple sclerosis and find ways to treat it.